My interest in healthcare didn't exactly start in the healthcare field. It started with an interest in streamlining customer experience. So working in retail when I was younger, and I found a wonderful opportunity to dovetail that into where I was working in the healthcare environment at that point and evolve myself from being more of an administrative role into more of a care coordinator. And that evolved into a position being a care coordinator for patients in a larger healthcare system. What I found was, in the effort to improve patient experience and improve the customer experience within healthcare, a lot of the things that were working against that effort had to do with the infrastructure and the way that we provide that service and the needs that we have in order to conduct that business. While I was working in that role, I saw an architect moving through the hospital one day. At least I assumed they were an architect. They had a roll of drawings under their hand. And I thought, how interesting is that this person comes from the outside and is able to so intimately understand this building, that I had firsthand experienced how complicated it was, and can visualize the improvement of it. And it inspired me to want to learn more about how I could take that experience that I have from the patient's perspective and from the staff perspective and inform the design of those spaces. It was a big transition for my family when I decided to transition out of the patient care environment and pursue an entirely new career in architecture and pursue a profession that is rather demanding. It was a big undertaking, but having my kids alongside me with it was probably the biggest factor I have for why I was successful in getting through the education experience, the training experience, and then continuing to evolve in the profession, because I was able to see what it is that I was working for. I think what first drew me to CPL was an opportunity to explore something new. I've gotten to really lean into the stuff that makes me the most excited to do every day at work, which is that planning side, which is the working with healthcare clients and visioning what their project needs are and what they can be through good ideas. The culture in Florida is heavily relationship driven, so we're working at building those relationships now, and we're excited about the opportunities that we've had with several local healthcare systems and being their partner and working on outpatient clinics and helping them translate their current hospital standards into outpatient settings. We're helping Lakeland Regional with this. We're helping New Morris Children's Health with this. It's meaningful work and it's meaningful relationships that we're building with those healthcare systems. Right now I'm working on a concept development plan for a cancer institute for a local hospital system. They're looking to create an infusion suite with some private and what we call neighborhood style infusion chairs to help patients with their cancer therapy. And then in addition to that, we would provide design for linear accelerators so that they can receive imaging guided treatment, and then also clinics for the oncologists to provide care for the patients that are receiving those cancer therapies. One of the exciting things about healthcare is that if I were to compare it to other markets that you might work in, like a multifamily development or a retail space, the decisions that we're making are long-term. They are going to impact the care environment and the community for many years to come, for several generations. We're seeing a significant change in the healthcare environment and changes in how our healthcare providers are providing care. We're seeing shifts to more outpatient care. We're seeing an emphasis on more behavioral health. And all of this is changing the mindset and the priorities of what healthcare systems are looking to grow and evolve their infrastructure and architecture around. Getting to be a healthcare planner in that, it's exciting to have a front row seat to some of that decision-making process and to be able to contribute to it in a meaningful way to help guide good ideas and coming out and help them craft their story and define the why that is going to influence future generations that are receiving care in those environments and the communities that they're serving. I'm Linaea Floden. Let's create something together.